Hey there skincare enthusiasts, welcome back to Glitz and Glow Dermatology channel. Today we have a very special treat for you. We are diving deep into the topic that affects many of us at some point in our life, that is acne. And to make this discussion even more valuable, we have a distinguished guest joining us today. That is my dad, Dr. Prakash Kolorgi, who is a senior dermatologist with decades of experience in the field.
I am Dr. Prakash Kolorgi, dermatologist, practicing in Gadag since 1993. We established the laser center, first of its kind in northern part of Karnataka.
Now let's dive deep into the causes of acne. Dad, could you shed us some light on what exactly causes acne?
The acne is nothing but commonly called as pimples. These are seen in the teenage group, which is very psychologically disturbing for them. Most of the time, the kids, they stand in front of the mirror and try to look at the lesions and try to pinch them. Acne is commonly called as pimples. These are seen on the face, trunk, shoulders and chest. Very commonly seen in the teenage group, that is between 13 to even it can be extended up to 35 years of age. These acne can be classified as mild, moderate and severe. The commonest cause for this acne is related to the hormones. 80% of the ladies, they develop this acne just 1 week prior to the cycles and later it starts disappearing. The rest of the cases, it can be because of usage of the cosmetics like powders, creams and etc.
As my dad explained, acne is primarily caused by the clogging of hair follicles. Hormonal changes such as those during the puberty or pregnancy can increase oil production. Genetics can also play a significant role, and certain skincare products like heavy moisturizers or pore clogging makeup can exacerbate this condition. Now let's move on to the types of acne and their corresponding treatments.
The mild form of acne, it usually requires only simple cleansing and nothing else is required, and it doesn't have any erythema or the redness or anything. Small pimples will be there over the face and they disappear. The moderate variety, they will have the erythema around them and few pustules, that is pus-filled lesions will be there, and they have to be managed with cleansing agents, the topical gels or the lotions or the creams, and even sometimes the oral antibiotics are required. The severe variety, they are called as a nodulocystic variety. Here what happens is, between the acne, that is a pilosebaceous unit, wherein the sebaceous glands are interconnected and you will have the tunnels inside and the lesions will be bigger, they look cystic. Most of these are going to end up with the scars or the pits or sometimes even the nodules. Here, the severe variety, we have to go for the intralesional injections. Sometimes we have to go for drainage. Sometimes we have to use the lasers, and the isotretinoin is commonly indicated in these cases unless the patient is pregnant or they are in the vulnerability of having pregnancy. And the caution is they have to be warned well in advance. Even they have to be informed and the consent has to be taken before we prescribe the isotretinoin in all these patients. Whenever we are giving the treatment, most oftenly they have to be instructed about the maintenance of the acne as well as the application of topical sunscreening agents.
Thanks, Dad. It's essential to match the right treatment to the type of acne you're experiencing. For example, topical creams containing ingredients like benzoyl peroxide or salicylic acid are often used for whiteheads and blackheads, while pustules and papules may require oral antibiotics. Cysts, being more severe, may necessitate stronger oral medications or even procedures like chemical peels. This is where the understanding of the specific type of acne you're dealing with becomes crucial, as it directly affects the treatment approach. Well, that brings us to the end of today's video. A heartfelt thank you to my dad, Dr. Prakash Kolorgi, for gracing us with the invaluable knowledge and expertise. If you found this video informative and enjoyed having Dad as a special guest, please give it a thumbs up and consider subscribing to Glitz and Glow Dermatology channel for more skincare insights. And remember, taking care of your skin is a journey and not a destination. Don't hesitate to consult with a dermatologist if you have a specific skin concern. We wish you all the best on your path to a successful and a radiant skin.